Recovery Daily Podcast. I'm your host, Rachel Abbasi. I'm a grateful recovering alcoholic and stroke survivor. And yesterday, I got my loop monitor implant. So because they did not come up conclusively with why I had my stroke neurologist specialist suggested that I get a loop monitor. It's a little heart monitor about the size of a piece of Trident gum, they say. I didn't see it before they stuck it in there. And it stays in you anywhere from 1 to 4 years, and it's right here in my chest. Yes, it hurts right now. It's very bruised, and it hurts when you touch it. But it stays in there and monitors your heart for the next few years. So this is for people who maybe you have AFib, but you don't know it. And I think they call it silent AFib. AFib runs in my family. And I'm the only one who has not been diagnosed with AFib on my father's side, but I had a stroke. So interesting, not funny, but interesting. So I wanted to talk a little bit about what that was like, just in case there's somebody else who has that ahead of them, needing to get a loop monitor. And then I wanted to talk a little bit about, I guess, just dealing with life on life's terms. Whenever I have any kind of doctor's appointment, I tend to get in a little bit of a state of self-pity, and I'm feeling that way today. I can't really even put it into words, which is not going to work well for a podcast, but I'm kidding. So I'm going to try. I'm going to try to put it into words what I feel like, because I know I'm not the only one. I know I'm not unique. So if I can put it into words, then maybe I can help another person who is in stroke recovery or vestibular recovery relate and know that you're not alone as well. So we had to drive into DC. It was at Georgetown Hospital. Which, with a vestibular disorder that is triggered by movement, it's extremely difficult for me to ride long distances in the car. And it is exacerbated by riding in the car in a place like DC, where, I was listening to Waze tell my husband where to go. And it was like, it was like, get in the right lane, turn right, and then immediately get over to the left lane, turn left, and then merge right. It was like constant. And meanwhile, I have my eyes closed because I can't handle the looking when the car is moving. And I'm not gonna lie, like, I opened my eyes so many times in that ride because it's unsettling. I've gotten pretty good at riding in the car with my eyes closed when we're going somewhere locally. But riding in the car, and like in DC, there's just unexpected sounds from the street. And, sometimes there's crazy people like screaming, and there's fire trucks. And it's nearly impossible for me to keep my eyes closed. So I feel that's why I did not record yesterday. I was going to record, but it just was not gonna work for me. It was just I have too many symptoms right now, and I still have them, but it is always a little bit better about an hour or so after I wake up, and then my symptoms kind of increase throughout the day. So I wanted to record. So we got into Georgetown Hospital. They treat it like any surgery. So it is a simple procedure. That's what they call it. And it is. I mean, the actual procedure where the doctor was in there doing his thing took 2 minutes, maybe 3 minutes. I mean, that's what it seemed like when he was actually numbing me and putting it in. It was like really, really fast. But the preparation for it, as I said, like I wasn't nervous at all. I wasn't really nervous until I got in there and you start seeing that formal um, sanitation of everything, and the guy comes in to start putting out all of the tools required to make the incision and to numb the chest area and all that stuff, and so I started getting nervous, and but I felt pretty calm still. Like I felt an underlying sense of maybe a little bit of anxiety, and then as he started setting me up, what they did was, so I'm laying in the actual room where typically, if you have a real surgery, you're in a pre-surgical room where they get you ready, you change into your gown and all that stuff. So I did all of that. And then they wheel all of the procedure tools and everything into that same room. So it happens right in that room. They just shut the curtain. And I had so I could leave all of my clothes on from the waist down, and then I wore a gown on top. And my brain's moving really slow today, so I apologize. But um they I guess they laid me down, and then they have this big plastic like window that they put behind my head, and that's so that when they put a blanket over you, like they cover your head so that the blanket's not laying on your face. It lays over top of that plastic window above your head. So I was covered. My entire body was covered. The only place that was open was the place that they were doing the procedure. Um, and that started making me really nervous. Like, I think it's definitely good that you can't see what they're doing because they're cutting into your skin and putting needles in you and all kinds of stuff. But that's all. Like, there's no, what I really wanted was a freaking sedative. That's what I wanted. I was thinking afterwards, and I'll get to how I felt afterwards, but I was thinking, do I want a drink right now? And the answer was no. But I did want a sedative. And the reason why is because afterwards, about when he inserted the needle to numb my chest, I started having a panic attack. And it it did not affect anything. I'm sure my blood pressure went up. I'm sure my heart rate was definitely went up. But it didn't affect anything. It wasn't a panic attack like I was saying anything out loud. It was just, I just started trembling and was pretty freaked out by the situation. I was not expecting that. So, the doctor numbs you. It seemed like they were numbing after numbing. Like it seemed like there were a couple needles that went in for numbing. And then after that, he said, "Do you feel a sharp pain right now?" And I was like, what?" I said, "A sharp pain? No." So he just said, "Okay." And then what he was doing was I think he was cutting open. And then I could feel pressure and they were like putting it in. I found out later that's what that was when they were actually putting the loop monitor in. And then that's it. I mean, it was like 2 minutes. Thankfully, it was like 2 minutes because I was shaking. And I don't even know if they could feel me shaking, but my arms and everything were shaking. And of course, when I get like that, I start getting really cold. And so I just turned into a physical mess when that started. And then he said, okay, we're done. And so another guy put in some stitches and then glues it shut. And then I laid there to let the glue dry. And then they are like, okay, you're done. You can get dressed. And I'm like, I feel like I need some counseling or talk therapy after this. Like, I feel like I'm traumatized. So I was shaking until we were on our way. We were just about out of DC when we were driving. So I was really flustered. I don't even know the right word. I was really affected anxiety wise by the situation. Um, this is the second time I've been in a situation where they are doing something. One was at the dentist, and this was this time where they do this stuff with minimal numbing, or at the dentist it was no numbing, one of the things that they did, which was really, really aggravating. This one was not aggravating, but they do this stuff because um, the procedure is so fast that they are just like, it's okay, they'll get through it, you know? And I think that they discount the fact that it is emotionally difficult to go through something like that. I mean, it was scary. It was scary. And I'm not discounting like my I know somebody very close to me who had ablation recently, where they are helping you to counteract your AFib. And that is like a surgery. I mean, they still call it a procedure, but it's more of a surgery than mine was. Mine was totally just a procedure. I guess it's called a surgery still. They're cutting you open. But I don't want to discount like other people having more critical things being done to their body, but this was one where you're awake and they're like cutting. I don't know. It was scary, and I think that that's fine to say that it was scary. It doesn't discount anybody else. I'm not comparing myself to anyone. I'm just telling you from my experience, it was a little bit scary. But if there is anybody who is has that ahead of them, it was easy. It was simple. And if you don't have an issue with things like that typically, then it won't be as scary. I mean, what was the scariest part for me? I don't know. It's just because it's unknown. It's unexpected. It's something I've never experienced before. If I had to do it again, it probably wouldn't be as scary, I guess. But the fact that they put the sheet over your head and you're like, you don't know what's happening. You know, they were pretty good about telling me what was happening. But so that's my account of the event. It was scary. It was not painful. I mean, I have more soreness right now. It just feels like a very, very bruised um, wound. That's what it feels like. But the procedure was not painful at all. So just like when you get your mouth, when you get numbed and they stick the needle in you, that's the only thing that was, felt like the normal numbing feeling where they stick the needle in you. That was probably the most painful. And I wouldn't even call that painful. So there you have it. That's what it was like to get my loop monitor. Unfortunately, I got a call this morning that said, okay, we need to schedule a 3-week follow-up for a device check. And I was like, are you telling me we have to go back into DC? And she said, yeah. And I said, is there any way to do it virtually? And she said, no. And I was like, all right, well, I'm going to get a second opinion on that. I did schedule it for 3 weeks from now, but there's a couple people at that office who who empathize with my disability. So they might be able to do this virtually. I mean, why would I have to come in and do a device check? It's not like they're gonna go in there and pull the device out and check it. They don't need my body to do a device check. I have the app on my phone, so as long as that's transmitting, I don't see why they would need my body there. And make sure that my wound is healing fine. I can tell you that you know, I used to be like, okay, we have to do whatever the doctors say. And I've gotten to the point where I'm like, a lot of times I feel like they just want my money. This is what we do. We have a device check afterwards. And I'm like, I don't know that I'm buying in on that. It's in there and it's transmitting. I don't know that you need to see me anymore. So we will see. I've already reached out to a woman that I spoke to prior to my procedure who was absolutely one of the nicest people that I've talked to at MedStar Health. And I think she might be at the doctor's office that did the procedure. So hopefully she can help me maybe make that a virtual appointment. The only reason I'm telling you what it was like to do the loop monitor is so that the experience will be better for the next person. Like I didn't know they were going to cover my whole body and just have my chest open. I didn't know any of that. They were really nice about walking me through what was going to happen in the different stages of making my appointment and all of that stuff. But I didn't know specifically what was going to happen. And what I've learned in my program is because I am trying to live life on life's terms that I didn't future trip. And I think that's why I wasn't nervous. I really was responding to the situation that I was in at the time that it happened. And I think that I've been benefiting from that in that I'm not feeling so anxious all the time. And I'm just going to stop there because my brain is just not working this morning. So I had to cut out a bunch of me starting and stopping. And yeah, I just have a lot of symptoms right now. But I will just stop there at sharing about what the experience was like for getting the loop recorder. And we'll be back tomorrow, hopefully, with something a little more inspiring, to say the least. So thanks for joining me today. I'm going to rest up. I have another doctor's appointment today. Um, it's the way of life for someone in full-time recovery. But thanks for joining me, and I'll talk to you tomorrow.